People with Lyme disease want lawmakers to renew the Kay Hagan Tick Act. So that's named after a North Carolina senator who died from a tick-borne disease and would fund research, prevention, diagnosis, and treatment for another 5 years.
The effort is urgent because Maine has already seen more Lyme disease cases than last year's record of more than 3,200 cases. News Center Maine's Vivian Lee has more.
They are small, they are silent, and they are spreading faster than we can stop them.
This PSA has aired nationwide, urging Congress to address the tick-borne disease crisis, as well as sending an important message to the public.
Every time they come home, they need to check for ticks because their health and livelihood literally depends on it.
Adina Berkowitz knows firsthand. She has late-stage neurological Lyme disease and several co-infections that have damaged her nervous system, causing symptoms similar to congestive heart failure. She also has late-stage lupus.
How many of you guys have ever been bitten by a tick?
Berkowitz founded and leads Lyme TV, a nonprofit that educates people about Lyme disease and other tick-borne illnesses. The group started a campaign called The Silent Invasion, a crisis we can no longer ignore, urging senators to pass the Kay Hagan Tick Reauthorization Act. Maine Senator Susan Collins is the primary sponsor. The bill was advanced out of committee this summer.
Reauthorizing the Tick Act would allow crucial developments, such as the development of a vaccine, to continue.
Renewing this law would help Maine and other states track new tick species and the diseases they spread, keeping the public informed. It would also fund regional centers of excellence in vector-borne diseases, such as the University of Maine's Tick Lab, for another 5 years. Griffin Dill, who runs the Tick Lab, says this is important because new tick species are emerging.
How and when and where these different tick species will move, likelihood of pathogen infection in some of these novel tick species.
If the act passes, the Department of Health and Human Services will keep updating its national public health strategy to prevent and control diseases spread by ticks. The law would also renew CDC grants to state health departments to improve data collection, support early detection and diagnosis, improve treatment, and raise awareness. Megan Bradshaw, Government Relations Manager for the Center for Lyme Action, works to increase federal funding for tick-borne disease solutions. She went 13 years without a diagnosis for Lyme and other serious co-infections.
And we want to make sure that we have the right diagnostics in place, we have good prevention programs in place, and of course, therapeutics and provider education so that when someone is exposed to a vector-borne disease, like a tick-borne disease, there's early intervention and there are better patient outcomes.
Each year, about 500,000 new Lyme cases are expected across the country. Maine is on track to exceed last year's record of more than 3,200 cases. Patient advocates say Congress needs to act.
It would be a failure of leadership. It would be a critical disaster to not have this funding.
The law could provide more than $27 million through 2030. This funding is critical to build on progress made over the past 5 years as ticks continue to spread across our state. In Yarmouth, Vivian Lee, News Center, Maine.
A vote on the Kay Hagan Tick Reauthorization Act on the Senate floor has not been scheduled yet.